Welcome, everyone, to our discussion today. We're going to delve into the role that schools can play in supporting students facing chronic illness. First, we're going to try to understand the situations and the unique needs of these children. And then we're going to look at how schools can act as effective allies. Let's begin with some statistics. In 2010, Von Cleve et al. Did a longitudinal study of students with chronic illness. And something that they noted in their study was that the number of students experiencing chronic conditions was increasing, and it was increasing at a dramatic rate. On the website for the Center for Disease Control, it states that in the United States, more than 40% of school aged children and adolescents have at least one chronic health condition. What does that mean for us? That means that in our classroom of 30 students, you can expect that 12 or more students are experiencing chronic illness. For the purpose of my presentation today, I'm going to be looking at those chronic conditions that are both rare and invisible, because those are the situations that are most misunderstood. When you hear hoofbeats, think of horses, not zebras. Have you ever heard this phrase? What do you think it means? In the 1940s, Dr. Theodore Woodward first used this phrase to encourage medical students to look for the simple explanation. The reason is because when doctors seek out the rare or unusual, they're going to subject their patients to unnecessary, sometimes painful, oftentimes very costly tests. However, it is important to note that zebras do exist. Hi, my name is Denise Berg, and just like you, I wear many hats. I am an elementary school educator with 25 years of teaching experience. I am a candidate for the Master of Arts in Social and Emotional Learning at National University in San Diego. And most importantly, I am a mother, and my daughter Morgan is a medical zebra. With the permission of my daughter Morgan, who is now an adult, I will frame the experiences of a child with chronic illnesses through our personal experiences. Invisible illnesses are chronic conditions whose symptoms are not visible to the common observer. Even with the same diagnoses, the symptoms vary by individual. Furthermore, many people battle comorbidities of multiple illnesses. I'm going to use Morgan as an example. Here are a few of her diagnoses: postural orthostatic tachycardia syndrome, median arcuate ligament syndrome, mixed irritable bowel syndrome, dumping syndrome, mast cell activation syndrome, eczema. It is common for doctors to refuse to see patients who are medical zebras because they are too complicated or beyond the doctor's scope of understanding, or worse, because they believe the issues are psychiatric in nature and not legitimate medical concerns. It can take many years for the diagnoses of suspected illnesses because tests may be complicated or inconclusive, or depend only on reported symptoms from patients. Insurance companies might also refuse to pay for necessary testing. Other suspected diagnoses for Morgan include fibromyalgia, platelet disorder, and vascular Ehlers-Danlos syndrome. For the last one, we've been working literally 6 years to try to get diagnosis for that. The following is from Rainey et al. 2020. Children with chronic illnesses may feel different from other children. They are more likely to require frequent doctor and hospital visits, which can lead to chronic absenteeism. Poor school attendance, along with having other needs, can cause them to struggle with academic achievement. Children with chronic illnesses may also undergo procedures that are painful and stress-inducing. They may have to take medications and or receive treatments during the school day, which draws more attention to their absence from class. Their activities may be limited or restricted, and they can also be put on special diets, all factors causing them to feel isolated from their peers. In 2003, Christine Miserandino used the analogy of spoons to help people who do not have an invisible illness know what it's like to live with this condition. Imagine having to give a spoon for everything you do on a given day, like going to work, having coffee with friends, making dinner, taking a shower, or even washing the dishes. Most healthy individuals have more than enough spoons they need to get through the day. However, people with invisible illness have a very limited number of spoons, and they need to be careful about how they use them because once they're out, they're out. Furthermore, there's going to be days when you wake up with fewer spoons. So the impact is that some days people with invisible illnesses are going to have to stay in bed when really they'd rather be spending time with friends. This video shows an example of a morning for somebody who has an invisible illness who is waking up with fewer than normal spoons.
I started out my freshman year being a very successful student, and around my sophomore year, I started dealing with the onset of chronic illness. I ended up starting to fail my classes because I physically wasn't well enough to be able to go to school. This was really difficult for me as someone who's always really prioritized achievement and metrics like grades. Seeing those kinds of things fall and feeling like I wasn't succeeding was very detrimental to my mental health.
Morgan is not unique in her battle with mental health. Children experiencing a chronic condition and their families experience a variety of traumatic stress that can lead to post-traumatic stress disorder and other mental health difficulties. Butler et al. Preliminary evidence suggests that mental disorders in children with a physical condition is very common and has a negative impact on quality of life over time. From the U.S. Department of Health and Human Services 2021. Children and adolescents with chronic illnesses often face more challenges than their healthy peers in navigating adolescence. They experience many forms of stress, and they are at higher risk for developing a mental illness. Lunkenheimer et al. 2023. Adolescents and young adults with a chronic disease have a 3-fold higher risk of traumatic stress disorder than healthy controls. And finally, Garay 2024. Parents can also even develop post-traumatic stress disorders. As we take a moment to practice self-care, consider the power of this type of activity in your classroom. Let's do some deep centered breathing. Sit up in your chair and place your feet flat on the ground. Put your hands on your lap and let's take a deep breath in through our nose. Pull the air past your lungs and let it flow into your stomach. Hold the air for just a moment before breathing out through your mouth. Let's do this 2 more times. Deep breath in, past your lungs into your stomach. Hold it. Now slowly release it through your mouth like you're blowing bubbles. One more deep breath in. Hold and out. When dealing with our students with chronic, rare, invisible illnesses in their families, please be empathetic to the fact that they are already fighting difficult physical and emotional battles. Furthermore, be sensitive to the fact that for many adolescents, the chronic illness has forced them to give up or change their dreams. Many were aspiring athletes or dancers. As an adolescent, Morgan vacillated between two big aspirations. She wanted to attend an Ivy League school right after high school, and she wanted to perform on Broadway. Due to her illness, she had to attend a junior college instead and had to completely give up her dream of being a performer. The Department of Health State Government of Victoria, Australia in 2012 provides some excellent general recommendations for how schools can help families. The family and the school need to work together to establish and maintain good communication and cooperation. Everyone needs to understand what is needed and expected to support the child. Regular communication between the school and the family is the best way to monitor how the child is coping at school and at home. That is academically, socially, physically, and emotionally. For younger children, writing daily messages in a homeschool communication book may help. Teachers and parents can then describe changes in energy levels, whether your child is working, keeping up with schoolwork, taking part in everyday activities, or how they are just generally feeling. Some schools have policies where students are unable to attend social events due to failing grades or absences. Sick children already feel isolated, and participating in activities can make the transition back to school easier. Feeling connected is critical to their emotional and social development. So, my recommendation is to change those policies for that child. Schools should work with students and their parents to craft individualized accommodations tailored to each child's needs. As a result of their chronic health conditions, these children may require 504 accommodations or special education services from their schools. It is critical to meet the needs of these children because the literature has shown that children with chronic health conditions are at a higher risk of disengaging from education than children without chronic health conditions. That's from Rainey et al. 2020. The Dysautonomia International website offers a wealth of resources designed to assist students in facilitating student success. This includes a comprehensive list of recommended accommodations. They offer suggestions addressing the effects of chronic absenteeism, fatigue, focus, inclusion, academic performance, health, and safety. If you walk away from this presentation with nothing else, I hope that you will explore this site.
It's people like my high school choir teacher. It didn't matter if I was feeling well or unwell, if I was, sitting in the choir room having a little mental breakdown because I felt like I wasn't meeting the expectations that I set for myself. She would sit there with me and listen to what I was feeling. This other teacher, what she did for me was she provided flexible structure in the classroom that was focused around what can I handle in any given day. She was so encouraging and always pushed me just a little bit to make sure that I was getting done what I needed to get done that senior year to ensure that I was graduating on time.
The good news is that in some cases, as children and adolescents mature, the effects of chronic illness may lessen. This may be because they are better at managing their illness and know how to avoid triggers that will make their symptoms worse, or because they have received treatments that have had a positive effect on their health. Regardless of the outcomes, schools play an important role in ensuring students are ready for a brighter future. As for Morgan, she spent 3 years at Orange Coast College and is currently a junior at Stanford University. She still has good days and bad days. She is already familiar with the emergency room and urgent care facilities in the area. Despite these challenges, she is getting straight A's and hopes to one day become a pediatric autonomic neurologist. I want to thank you for taking the time to learn more about children with chronic illnesses. I would also like to recognize the hard work of all the zebras and spoonies out there who are continuing to make amazing contribution to others while fighting their own battles.